Tuskegee experiment was a 40-year-long study conducted by the United States Public Health Service that wanted to study the course of the STD syphilis. Between 1932 and 1972, USPHS monitored the development of the disease in 600 African American men until death. This meant known treatments were withheld for the duration of the study. Syphilis is transmitted sexually or from mother to child. It is a bacterial infection that causes genital and mouth sores. This leads to a rash covering the body and eventual death by internal organ failure. The Center for Disease Control notes that it can have serious complications if left untreated, but it is simple to cure with the right treatment, a penicillin antibiotic, which was discovered in 1928. In Macon County, Alabama, a flyer advertised that African Americans should come and get tested for bad blood. If they qualified for the study, they would get free medical exams, free meals on exam days, and burial insurance. 600 male African American volunteers were approved for the study, 399 with syphilis and 201 without. However, the exact details nor the intention of withholding treatment were disclosed. The men were not informed that they had syphilis, nor that they could spread the disease to their sexual partners. This fact makes the number of victims of this unethical study much higher than can be concretely confirmed.
The Tuskegee study raised a lot of ethical issues such as informed consent, racism, paternalism, unfair subject selection in research, malfeasance, truth-telling, and justice. The IRB tackled the definition of who a vulnerable group is and if they should be invited into an experiment. They say vulnerable individuals lacking power may also fail either to understand that they can readily withdraw from a study at any point or to feel empowered to do so. They may fear angering powerful researchers. The African Americans of this study fit the description perfectly. They were poor, semi-literate black males living in rural Alabama during a time of the civil rights movement and had no power against the whites in the South. High syphilis rates were always credited to the African American population, as well as the expectation that syphilis was an endemic to the black population because of their sexual immorality, as opposed to the white people. It was unethical of the researchers to purposely withhold available treatment for the black population, which was penicillin, a known treatment at the time. These men joined the study under false pretenses because the health workers never informed them that they had syphilis or that they would not be receiving treatment for it. They were told they were getting treated for bad blood only and did not give specifics. The men were not told they could spread the disease to their sexual partners, so the health workers were allowing these men in the study to continue having sex with these people and spreading syphilis to them as well. These people who now have syphilis did not get treatment and were not considered part of the study. These men were also not told that they were part of an experiment predicted on the non-treatment of syphilis until their death.
Prior to the Tuskegee experiments, there were no laws or regulations regarding experimentation or research done on human subjects. While the Tuskegee experiment was in motion, multiple laws were passed, such as the Nuremberg Code and the Declaration of Helsinki, which stated that all participants must have informed consent and the study must avoid unnecessary suffering. These, along with other pieces of legislation that were passed in the time the experiment was being conducted, were ignored. The National Research Act was passed in 1974 after the termination of the Tuskegee experiment, which required all research funded by the government to be approved by an institutional review board. This act also ultimately resulted in the Belmont Report. The most important part of the Belmont Report defines ethical principles that are required in all research and describes how those principles should be applied. First, there is respect for persons, which means all participants must have informed consent. Second, there is the principle of beneficence, which means that the experiment should be designed in such a way as to maximize the benefits and minimize the risks. The final ethical principle is justice. All people should have an equal opportunity in being included in research that may benefit them. The duty of the Institutional Review Board is to make sure that all research is following the above regulations. If research protocol does not meet the appropriate standards, they have the ability to deny or make changes to experimental plans. The Tuskegee experiments drew attention to the lack of regulations, and now there are very strict regulations protecting human rights in the experimental world.
Dr. Rebecca Flietstra in the biology department. I teach human anatomy and physiology, but I also teach a couple upper division classes, advanced human physiology and neuroscience. The class I discuss the Tuskegee experiment in is advanced human physiology. Physiology is the study of how the body works, and most of our understanding of how the body works comes from experimentation, either with animals or with humans. So obviously that's very relevant to discuss how do we get that information. While it's important to understand how the body works, we also have to consider the good of the people who are actually being experimented on. We have a number of protections for people in medicine so that people are not harmed by experimentation. And I think that that is always needs to be primary in terms of things. And clearly in the Tuskegee experiment, it wasn't even a consideration to place those individuals or their families with any priority. And so I think it's important for students to see what happens when we don't care about the people who are giving us medical knowledge.
Dr. Sandoval is an adjunct professor at Point Loma Nazarene University. She teaches Introduction to Psychology and Abnormal Psychology. She specializes in neuropsychology and forensic psychology. When asked why it is important to still teach the Tuskegee experiment in class, her response was, "There are many reasons to include the Tuskegee experiment. One obvious reason is so that we do not repeat the past. However, this experiment also led to the Belmont Report and the Office for Human Research Protections. These restrict researchers from engaging in inhuman or any gruesome treatment, particular mediums and guidelines for deception and other unethical behavior. This experiment in particular, though, is one that reinforced and added to the historical trauma already experienced by the Black and African American communities in the United States. This population has been abused since their forced migration to the United States, and the continued cycle of abuse through racism, discrimination, and even horrendous studies like the Tuskegee experiment have added insult to injury. Additionally, the cultural paranoia surrounding doctors, professionals, and paraprofessionals within the community has very deep roots. It is important to be culturally and historically conscious, not just of the past, but of current and future acts we engage in as well."
This is from an email interview with Dr. V, who covers the Tuskegee experiment in her Introduction to Sociology and Race and Ethnicity classes. She emphasizes that the study lasted for 40 years and would have kept going if it weren't for people who spoke up. One of the most notable people that spoke up was William Carter Jenkins, who worked for the Public Health Service. However, no one listened to him, likely because he was Black. Then there was Peter Buxton, a disease investigator in San Francisco, who was a white man. He also spoke up, and when people did not listen to him, he did not give up. He kept working towards ways of exposing this matter. Finally, he got a journalist to report on it, and that was when the Public Health Service finally stopped. Dr. V believes that we need people to speak up when they sense that something does not feel humane. Both Jenkins and Buxton knew that there were risks to their career and livelihood if they spoke up, but they felt that it was more important to do what was right. She is grateful for people like them who were brave and persistent. Jenkins kept using his voice even when confronted with racism, and Buxton could have given up, yet instead he persevered until he got the public health services to stop. He used his privileges and connections to help.
The CDC records in 1973, Congress heard the lawsuit filed on behalf of the subjects of the Tuskegee Syphilis Study, and a settlement of $10 million was reached. Eventually, the government also promised lifetime health services to victims and their families. President Clinton publicly apologized to the victims of the study in 1997. Since then, steps have been taken to set up councils, centers, and research facilities on bioethics. Hopefully, we will continue to improve as a nation and to learn about the world around us, but not at the expense of others.